All right. Terrific. Good afternoon, or in some cases, good morning, everyone. It's good to see everybody. I hope everybody is doing all right. Kind of just our question of the day, throw it into the chat. We're just wondering things that inspired you from this weekend. Anybody have any amazing things that happened, either wins in your shelter or in your personal life, or yeah, go ahead and share those in the chat to get things going. For those who don't know me, I'm Ed Jameson. I am the CEO for Operation Kindness, just north of the wonderful city of Dallas. We're coming off, we had a very stormy weekend here. So I didn't have power at my farm for the better part of the weekend. And then I'm sure some of you saw the horrible situation in Allen, Texas, just north of us. Yet again, another senseless mass shooting. So our thoughts and prayers are with everyone involved there, and hopefully we can come with some answer to stop these things from happening like they seem to be doing. Okay. All right. We've got a really cool talk today, but before we get into that, we've got a couple of things that we want to jump into. I think first and foremost, do we have someone from the Maddie's team that is going to announce the April Community Convo grant winners? Somebody from Maddie's on for that?
Hey, good morning or good afternoon, Ed. I am here and I am excited to announce those winners.
Awesome. We know you are. Go for it, Amber.
Oh, great. Okay. Let me just go ahead and share my screen. Does everybody see that? Prize winners?
Yeah.
Okay, cool. So this month we have 4 prize winners winning a prize of $2,500 each. And without further ado, those folks are Ginger Gaskins from Berkeley Animal Center in South Carolina, Jennifer Hendrickson from Jessica Hendrickson from Kenai Animal Shelter in Alaska, Jim Keller from Homeward Pet Adoption Center in Washington State, and Rebecca LaDranca from Engan County Animal Control and Shelter in Mason, Michigan. And this person already knows they won, but I think it's worth celebrating as well. We have one winner from the Maddie's Pet Forum. That person won $3,000, and that is Tamara Cook from Harris County Pets in Houston, Texas. So Irene and I will be getting in contact with everyone later this week about their grants, but congratulations, and please keep watching on demand or in person so you have a chance to win. I'll drop the link to register for the drawing in the chat in just a little bit. Congratulations, everyone.
All right, terrific. Thank you, Amber, and congratulations to the winners. I mean, where else do you get that? Where you get to come and hang out with some cool friends every week, and then you have a chance to actually win money. So awesome, awesome, good stuff. Let's jump into national updates. So I know we've got a couple of things happening here in the animal world. Anybody want to jump on with some the national updates?
Hey, Ed, if you don't mind, I just would love to give a plug to Maddie's Insights webcast this Thursday. I'm going to put a link in the chat for everybody to register. But Dr. Kat Littlewood from New Zealand, Massey University, she's going to talk about the 5 domains model. And this is a study that could really be used in almost every shelter. So check it out, everybody. And they do get recorded and you can get CE credit for it. So if you can't make it, but just register.
Heck yeah. Awesome. All right.
Hello.
Hey, Vincent.
Yeah, this is Vincent with the Maddie's Director of the Human Animal Support Services Project. And just wanted to remind everybody, we do have a webinar coming up tomorrow, Compassionate Communication Supporting Pets and People and Pets Through Human-Centered Language. Our presenter tomorrow is a special guest, Shannon Glenn, the Executive Director of My Pit Bull is Family. And so far we have 850 registrations. So please get in. We're hoping to get to 1,000, but as you can see, very, very interesting topic and very influential speaker.
Wow. Absolutely.
If I can mention an upcoming webinar. I'm Suzanne from Good Pup. I wanted to share that our next free webinar, it's going to be Thursday, May 18th, 2 p.m. It'll be on mouthy behavior. It is a continuation of our spring series on surrender prevention. We'll look at what mouthiness is, teaching dogs better ways to communicate from the beginning than using their mouths, and best ways to address some of the behavior once it's already being exhibited. I'll put the registration link in the chat, and that one and all previous ones will be recorded and they're available on our website. I'll put that in the chat too.
Terrific. Thank you.
Hey gang, I don't know if there's a line because I just hopped on.
That's perfect.
It's okay.
Perfect.
All
Yep.
right. Oh, David Kerpel with Forever Home Dog Sanctuary in Richmond, Illinois. I just closed on our property last month. So we now own a 6-acre piece of land, and we are going to we're meeting with architects, and we're going to start building our structure to rescue and rehabilitate dogs. And the ones we can't rehabilitate, they get to spend the rest of their lives on our land, which is exciting. We're going to take them from shelters where they basically spent their whole lives, the ones that aren't getting adopted. But that's not why I'm talking. I wanted to find out, and I know I'm going to get a barrage of different answers, but the maze of CRMs is just incredible. The customer relation management tools, there are so many out there. And I was wondering if you guys could send me some chats on what is best, what you found to be better than others, which ones you haven't liked. Primarily for us, it's not the keeping track of all the dogs, because we're not going to have tons of turnover. We can only hold about 23 dogs at a time. So we will have some turnover, but mostly concentrating on donors and getting donors and things like that, keeping track of who are big donors, small donors, sending emails automatically, things like that, big database. But I don't need something huge again. So I don't know if anyone's got some ideas. So thanks.
Yeah, terrific. And yeah, if anybody's got anything for David, throw it in the chat here. You can private message him on the chat. Also, David, the Maddie's Pet Forum, this is a terrific. That's a great venue to throw that question also. Allison, you're able to throw the link to the Pet Forum just in case David or anyone else doesn't have that. Oh, there you are, already on it. So good stuff. Good stuff. Any other national updates? I know I can throw from the shelter animal count thing. We just released our Q1 data. Some good data in there, some scary things from the animal field, just as far as animals in and animals out. And also I know we've got a good data set together on the community dashboard also that we started collecting. So if you have not had a chance to look at those, definitely check out the data from shelter animals count. Any other national?
I'll pop in and say that as of last week and 8 years in the making, my Roundup for Pets nonprofit is actually, I finally received my 501c3 from the IRS. And so anybody who can send me or knows of someone in search of a chief technology officer position, because I can't say to the Red Cross, you invented the wheel, but every animal related farmers market, festival, pet groomer, etc., will start rounding up so we can have scholarships for veterinary students, make sure we have veterinarians in the future, and then expand from there.
Terrific. Thank you, Hope. All right. Anything else here nationally for the group? Going once. Going twice. All right. Very good. All right. We will keep it moving. Thank you, everybody, for sharing there. Very excited about the talk today. If you can remember back a few months ago, I hosted one of these calls and we were talking about canine influenza and how that was ripping through things in the Texas area and beyond. So it kind of came natural and easy to raise my hand when we had the opportunity to hear on this talk here today. It's definitely my honor and privilege to introduce our two speakers today. We're going to be talking about turning crisis into action, how a parvo outbreak changed the shelter's culture. With that, we get two amazing speakers today. Ramon Villatoro, Operations Manager from Norfolk Animal Care Center, as well as Dr. Chumkee Aziz, the Outreach Manager from UC Davis. With that, I will turn it over to Ramon and Chumkee. Thanks, guys.
Thanks, Ed. Ramon, I'm actually going to just introduce Ramon in the context of how Ramon and I got in touch. And then it's Ramon's show from there, so I'm going to hand it over to him. But Ramon got in touch with us a few months ago, when I should say that Ramon was only about 2 months into this new gig that he had started at Norfolk Animal Center in Virginia. And he got in touch with the UC Davis team because I know that, as many of y'all know, because capacity has been such a challenge across the country these past few months, especially, there has unfortunately been a number of outbreaks, as y'all have been saying. And so Ramon got in touch with us about a parvo outbreak, and some of the cases were just kind of fishy and kind of weird, like, hey, we quarantined and then we got another case and what's going on? We're not sure where the index case is coming from. And really, Ramon got in touch with me about that. But the conversations really changed and turned because Ramon was brand new. And yes, we did a lot of technical discussion around intake dates and vaccine dates and exposure and meaningful exposure. But really, the conversation started to turn and change towards change and how to use this outbreak, this unfortunate situation, to leverage change and to leverage support from the city and support from staff that, just to note, the staff had never dealt with a parvo outbreak in their known history, in the staff's known history. And so this was the first time this had happened. And so the reason I'm really excited here today to introduce Ramon is because what was an incredibly hard time at their shelter, and I imagine as a new manager at the shelter, Ramon I know it wasn't single-handed, but Ramon really made just sweeping changes. And it wasn't like, hey, this is what we need to do, this is what I'm going to change. It was sweeping changes with a lot of buy-in and a lot of voice from the staff. And Ramon is going to tell you all about it because it's really amazing. So Ramon, I'm going to hand it over to you.
Well, thank you, Dr. Aziz, for that introduction. I'm going to share my screen here. Okay, can everyone see my screen okay?
Yes.
Okay, thank you. So welcome, everyone. Today, we will be discussing my experience with how we turn crisis into action. And Dr. Aziz, would you like to just give yourself a little introduction?
I'm Dr. Chumkee Aziz. I'm with the shelter medicine program at Koret at UC Davis. And we do a lot of shelter consultation, including shelter outbreaks. And that's how Ramon got in touch with me. And so good to meet everyone here today.
And my name is Ramon Villatoro, and I have been in animal sheltering now for 12 years. And I have served in operations management and executive leadership roles. I currently serve as the operations manager for the Norfolk Animal Care Center. Now, before we get into the parvo outbreak, I wanted to spend a little time talking about what our facility looks like. The Norfolk Animal Care Center is the open admissions shelter for the city of Norfolk, and the population for Norfolk is around 250,000 citizens. And it is also home to the largest naval base in our country. Our average intake is around 4,000 animals per year. and dogs make up about 50% of our annual intake. Now, we ended 2022 with an 88 live release rate, and we also have about 22 full-time employees and 1 supervising vet. Animal control for the city works under the police department, which can be very challenging because we have such different views on what our roles in the community are. Now, the first CPV case happened in September 2022. It was a stray 7-month-old puppy who was in our kennel for 1 day until we had noticed bloody diarrhea. Our organization at the time had no executive director. I had just joined NAC in August of 2022, and it was about a month and a half into my new role. So I was brand new to the shelter, brand new to the city, and essentially I was put in a position to lead during an outbreak. Our shelter had gone through a lot leading up to this outbreak, and in the late 2010s, we had a live release rate of around 50%, and the community was screaming for change. Drastic changes were made that brought NAC to achieving its first no-kill year in 2021. However, this change pushed us to operate beyond our capacity. And we had dogs in crates. We had dogs in crates in offices, hallways, rooms intended for other purposes. And another risk factor for operating beyond our capacity for care was dogs were unvaccinated and would sit without a vaccine for days. Staff had never encountered canine parvovirus at all, even an isolated case. So when this occurred in September 22, the staff were not trained on how to properly respond or handle this. And the last and most critical risk factor is the facility. Our facility used to be a repair garage for large trucks. The building was retrofitted for the animal shelter. And in the photo that I have on the slide, that is our dog kennel. That is where the garage used to be for the large trucks. So you can see the high ceiling, and that's where all of our 50 dog kennels are for the Norfolk Animal Care Center. We also have single compartment dog kennels, which means we have to move our dogs to outdoor dog kennels for cleaning every day, which increases our risk of cross-contamination. We also do not have a proper isolation room on site. We have shared HVAC, and there are only 3 drainage trench for all 50 dog kennels. Urine and feces commonly would leak into the kennels. Now, we knew that we wanted to do things differently from the start. We had core principles on how to manage the outbreak, such as improving our sanitation protocol and trying to minimize intakes. But we wanted to try new and different things during this crisis. So we adopted a pilot and test approach for response where we experimented and tried many new things. I mentioned that staff was unfamiliar with CPV or disease illness response for that matter. So it was essential to develop written protocols and train staff on these protocols. We had weekly all staff meetings reviewing protocols, and this was also used as an open forum for questions for staff to kind of brainstorm through these new protocols. The first few weeks were scary for our staff. So on top of everything else that we were going through, it was also important for me to be an empathetic and compassionate leader during this crisis. We were very transparent with our community as well. Immediately, we sent out a press release and explained why we were doing what we were doing. And we also turned it into a call to action. We called on the city's support for help during this crisis. We also closed all owner surrenders until the observation period was over at attempts at minimizing the animals coming into our facility. Now, after the first week, we had several positive cases, and we knew that this was no longer an isolated incident, and we had an outbreak on our hands. I knew if we were going to get through this, that we needed to reach out for help. And I reached out to multiple organizations, UC Davis, ASPCA, and Best Friends Animal Society for help. And a lot of the new ideas and changes that I will be discussing during today's presentation came from my conversations with these organizations. A lot of my aha and come to light moments came from the calls with Dr. Aziz. I never felt alone during this fight. Being so new, a month and a half into this role, and then dealing with this crisis, I never felt like I didn't have the support. So huge shout out to UC Davis, ASPCA, and Best Friends for their help, because we wouldn't have gotten through it without their support. Now the good, the bad, and the ugly. We made huge improvements to our sanitation protocols, and we had PPE in all dog areas. We updated our cleaning protocol to combat the canine parvovirus. We had made many small tweaks throughout the outbreak. For example, at the beginning of the outbreak, we were taking dishes out of the dog kennel and washing them in the kitchen. But then we found that this was so risky and could lead to cross-contamination that we started leaving the dishes inside of the dog kennel during morning cleaning. We also started using rescue in our laundry. We had policies for rapid response to new cases. And because of our facility and the constraints of our facility, we were in a 14-day observation period with new cases. So whenever a new case would pop up, we'd restart that clock. We were being proactive with our vaccine protocol. Dogs were getting vaccinated in the animal control van before they would even enter our facility, or citizens who found a stray dog would alert our staff, so staff would meet them in the parking lot and vaccinate them in the car or outside. And this was critical for our staff to vaccinate incoming dogs before they even entered our facility. We also made sure that we were using our vaccines effectively. We were only using vaccines within 30 minutes of being drawn up. We made big changes to our diagnostics. We began titer testing every dog for antibody status. This helped us categorize our population by protective titer and low titers. And we also started testing animals with symptoms and animals before leaving our facility for either foster care, adoption, or being reunited with their owner. Now, it was essential to also put the same amount of focus and resources into our staff's mental health. My responsibility as a leader was to ensure my team was supported during this crisis. And the parvo outbreak was very traumatic and stressful for the team. As I mentioned in previous slides, this was the first parvo encounter for most of my staff. So I coordinated with our city's HR department in bringing in a counselor through the Employee Assistance Program. They did a group session and one-on-one sessions with a team. Now, if the EAP wasn't going to work out through our city's HR department, I had also approached our Friends of Group for assistance in paying for someone to come to the shelter. This is the importance we place on our staff's mental health, and we were determined to find a solution. Luckily for us, our EAP was easy to start. And the EAP is something we have continued to use to this day. Now, we also made sure to maintain a positive outlook during the outbreak. Here's a photo we use for social media celebrating our animal care team, who are the real heroes during this crisis. And in this photo, they were wearing the Tyvek seats worn during cleaning and handling the equipment that they use for cleaning. And I even created a NASA logo with our shelter abbreviation. And this was just an attempt at a lighthearted approach at celebrating our team and putting them and highlighting them for our community, while also highlighting the crisis that we were going through. Staff had also been working in a way that was counterproductive to operations, and most importantly to themselves. So for example, our animal care team wasn't empowered to make decisions, and our leadership team would help in every department, which did not allow them to focus on their own roles. Our volunteer coordinator couldn't focus on recruitment or engagement because they were focused on acting like an animal care manager. So it was important for us to establish clear boundaries to improve how we operated, and it was critical during the parvo outbreak to ensure our staff was focused. This also had positive impacts on staff's mental health because they didn't feel so much pressure on themselves, and it allowed them to focus on their roles. We were also utilizing our fosters for dogs. Now, we would only send out dogs with protective titers. So we were using our fosters, but in a safe way. We encourage volunteers to continue helping. In many cases, whenever there's an outbreak, some shelters usually just close up shop and kind of do not utilize volunteers during an outbreak. We, on the other hand, encourage volunteers to come and help and support. We would have volunteers wearing PPE while they were doing laundry or while they were doing dishes. And we also waived adoption and redemption fees for all animals during the crisis. This was very difficult to get staff buy-in because this challenged what the status quo was for NAC. And it was the beginning of shifting our focus towards ways of reducing barriers and also making a total culture shift. Which leads into the next point. We continued adoptions through the observation period. Now, the criteria for adoptions was having a high protective titer, a negative CPV test on outcome, and providing the adopter with a disclosure form, which included resources on what canine parvovirus was and disclosing that we were going through an outbreak. We focus heavily on shifting the way we viewed our adoptions by being more open and conversation-based. This was a lot of change happening for a team, and it was important to give them a platform to voice questions and opinions and debate new ideas in a healthy way. Now, what made the change easy is it just clicked for staff to go this route, especially when we were euthanizing for parvovirus and having animals in crates. It was essential to work together with our animal control team. That meant they were wearing our PPE when entering our facility. The officers would also sometimes vaccinate in the van if they were dropping off a dog overnight, or they would alert staff to vaccinate in the van. Court case holds were permitted to enter foster during the outbreak. And we also found through our case tracking that many cases came from the animal control vans. So we provided the officers with rescue spray bottles and trained them on how to properly mix. We made sure they had all the tools they needed to disinfect their vans. Now, during one of my conversations with Dr. Aziz, I knew it was important to get away from housing animals in crates. And I'll admit, this was very hard for me to put my ego aside. And I had never in my career encountered this. And I was having a sort of self-pity moment. And I really had to challenge myself to self-reflect on what I knew needed to be done. And during the outbreak, we as an organization made the commitment and promised to never allow a dog to sit in a crate. Now, unfortunately, that meant euthanizing a lot of dogs to bring us to a manageable number. Some hard lessons learned early on in the outbreak was at the start when we were titer testing, we isolated the first batch of low titers in the same room, which was mistake number one. And a few days later, 5 in the group showed symptoms and tested positive for parvovirus. Now, we ended up euthanizing the entire group because the risk was just too high to house animals with a low titer in our facility. And it was a very hard lesson learned at the start of the outbreak. We were also euthanizing animals who were unable to be safely vaccinated or titer tested because, again, the risk was just too high to house an unvaccinated dog in our care. For staff, it also felt like a never-ending battle. The outbreak lasted from September 22 to December 22. And new cases just kept popping up, especially towards the end of the 14-day observation period. A case would pop up on day 13 and it would reset the observation period. So it became kind of like a never-ending battle for staff. And lastly, it was accepting the hard truth that most of the positive cases were being exposed in our facility. So despite all the new protocols, despite all the sanitation improvements, they were still getting exposed in our facility. Now, this helped push us to innovate more and to challenge more on what our protocols and policies were. Now, to get support from city leadership, I had to turn into a super advocate. I had to be persistent and provide honest communication, especially during all the changes we were doing. I had to walk the city leaders through this. One thing that helped me was knowing that I had to be compassionate in my approach when communicating with city leadership. To us, euthanasia and life decision-making is common, but for city leaders, this is very difficult for them. And I wanted to make sure that I was getting the most impact with the city leadership. So I invited them to tour the facility. I wanted them to see the crates. I wanted them to see the animals. And I also wanted them to see the challenges we face because of the facility. Now, this took a lot of convincing, around 2 months, to finally get them to come into our facility. But I thought it was important for them to be on site. Now, afterwards, I prepared and presented a dog kennel assessment outlining areas of concern and a plan on how we can improve. And honestly, I had the best experience with city leadership because they trusted me and they supported me. It made decision-making easy because they valued my experience. Now, this slide is all about the action. We spent the last first half looking at our outbreak and the changes we made, but this is the slide where we focus on the action and how we turned the crisis and made significant change for the Norfolk Animal Care Center. Now, following the outbreak, we continue to uphold our promise in saying no to crate housing. And from tracking of cases, we were able to see that there was a need in the city for equitable access to vet care. We worked with our city's attorney's office in preparing forums to host our very first vaccine clinic, with hopes of hosting a clinic sometime soon. And also thanks to the dog kennel assessment, our city agreed to fund the purchase of double-sided kennels. The assessment also identified a risk of our intake room flooring. We are working on renovating our floor to reduce fomites and have non-porous surfaces. And most importantly, we are in the process of having council consideration for a new facility by fiscal year 26. Now, after all the experimenting, testing, and failing, we created the outbreak response plan. This protocol outlined essential procedures in the canine parvovirus response. Now, our team is prepared and ready to spring into action in the event of a new case. Now, regression was normal and was expected, but we had regression in several areas post-outbreak. Because we were so vigilant during the outbreak with vaccinating dogs, cats were being neglected. So cats would sometimes sit a few days without a vaccine. Staff had also become very paranoid when they saw diarrhea and would jump into outbreak mode at the sight of loose stool. Luckily, these were easy to correct by staying vigilant, communicating, and addressing with the team. And once we made it out of the outbreak and had some time to breathe, it was critical to build upon the cultural transformation that took place during the beginning of the outbreak. This meant working with our leadership team to define what kind of environment we wanted our shelter to have by developing a workplace culture agreement and a core set of values for the Norfolk Animal Care Center. When creating the workplace culture agreement, it was important to have our entire team's involvement in the process. Every single staff member at NAC contributed to the creation of our culture. Now, looking back at the experience, these are my biggest takeaways. Never stop learning and challenging yourself. And leading with positivity is key in getting through any crisis. And most importantly, together is better. Remembering that we are in this together in collaboration is essential at getting through any crisis. Thank you for your time and allowing me to share with you all my experience with turning crisis into action. Thank you.
Ramon, there were a few questions throughout the chat, and then there are a few more I was going to prompt you with, if that's okay.
Sure.
Kayla way earlier on asked, when you spoke about deferring owner surrenders during the outbreak, how did the public manage that? Like, how did they respond? And also, how did you spread that information, like social media or signage or?
So it was included on press releases. It was sent out in printed media and also social media. There were news channels that picked up the story. So we sent them out through various forms of media. And we were transparent, communicated with the community that this was essential at getting through the crisis. And one thing that we had thought we would see was a rise in stray animals, because there was no owner surrenders being admitted to the shelter. But we didn't see any rise in stray animals. The community was supportive and understanding of the crisis. And now there were some emergency cases that we would take for surrenders, but fortunately, because we were able to prepare and plan them out, we would just vaccinate them before they ever came into our facility. Or in some cases, they would foster, they would come, surrender them, do all the paperwork, but then foster that animal until we got out of an observation period.
And Ramon, I think you might have said this, but I think there's 56 kennels, is that correct?
56, yes.
And then how many dogs, though, were on site total at the beginning of the outbreak? And then how many do you think were affected overall?
At the start of the outbreak, we had around 90, 97, about 100 dogs in our care. So at the first case in September 2022, we had close to 100 dogs, and because of how our facility was set up, and I mentioned that we had single compartment kennels, meaning everyone had to go outside. Everyone in our care was exposed. So even if we were putting dogs that were on our adoption floor or dogs that were off site, it didn't matter once they got outside because it was chain link dog kennels outside, so they were all exposed to each other. So I want to say it impacted our entire population.
And then as a follow-up, Kayla just asked, have you updated your capacity for dogs for now?
We have not worked on formalizing a capacity for care plan. However, that is a focus for this year in having a capacity for care plan. The only thing that we have changed as far as how we manage our capacity is we've added the tools such as waiving adoption fees, waiving RTO fees, and also ensuring that we do not fall back into crates. So that's daily management to ensure that we don't get into crates or a situation where we will get into crates.
The other place I noticed a lot of people were commenting is when you were talking about mental health counseling and supporting your staff. And I particularly wanted to ask you, how did you recognize, it makes sense, but like when you're in a fire, sometimes you don't think of the other things you need to do other than just put out the fire. And so, I am so impressed by kind of your just like 360 view of everything. And so curious how you how that came about. Like how did that come to you that like, hey, I need to do X to make sure I support my staff this way?
I think the first week, and kind of just seeing the staff's kind of morale, their body language, and just how they would come into work, I knew that they were very scared and that they didn't have a lot of resources leading up to this moment on mental health. And I thought it was critical to put that same amount of attention to the staff's mental health that I was putting into developing these written protocols for sanitation. So it came up naturally. Now, I will also say the staff was vocal as well during this, that they were having a difficult time. So it was listening and actually acting on that feedback from the team.
And Mary Ellen is asking, what age are you starting vaccination, 6 weeks or 4 weeks?
We're currently doing 4 weeks.
And 4 weeks is what's recommended by the Association of Shelter Veterinarian Guidelines, which I was personally very excited to hear that Ramon and his entire team do like a book club, have started a book club around the ASV guidelines, and it warmed my heart. Ramona, if that's okay, I'll just keep going. Amy Charles asked, we're a group of volunteers. How can our core group convey updates and training and the importance of following protocols in light of outbreaks? And I have thoughts on that, but would love to hear your thoughts too. Oh, I'll go.
I'm sorry, Dr. Aziz, you broke up during.
Amy is asking, we are a group of volunteers. How can our core group convey updates and training and the importance of following protocols in light of outbreaks?
Well, this ties into, I made a point during the presentation that our staff had been operating in a way that was counterproductive. We had our volunteer coordinator who was kind of acting as a interim animal care manager, which took away from the focus of her role. So when we removed when we kind of placed those boundaries and reshifted our focus for these roles, it allowed our volunteer coordinator to really thrive in coordinating, training the resources with the volunteer team. Because as we were coming up with all these new changes to the laundry, the dishes, and our sanitation protocol, this was a lot of change for a volunteer team to also adapt to. So fortunately for us, our volunteer coordinator, because we were able to put those boundaries in place, she was able to focus on conveying and communicating with the volunteer team. We also utilized Better Impact for our volunteer software, and with Better Impact, we were utilizing the email feature where we were emailing our entire volunteer team at once with new changes and policy changes.
And Amy, or Ramon, if it's okay if I holler as well. Amy, you know, especially as volunteers, I feel that it's even more crucial. Like, y'all are volunteers. This is, you know, your side gig that you're so passionate about, but it's no different, of course, from being an employee or staff member and running, you know, a tight ship. And I will say that as a consultant that does outbreak management, like these are the types of technical questions I went through with Ramon, you know, like, let's talk about y'all know this, you know, the fridge temperature. Let's talk about, is there new staff? Is there someone who has been, you know, I mean, we've dealt with outbreaks where a Panluke outbreak where unfortunately like the diluent was being given as the vaccine instead of mixing the diluent in with the actual vaccination product, right? So asking those kind of technical and critical questions, of course, Ramona and I went through those. But when I think of volunteers and I think of like, y'all have such power and such importance in being the gatekeepers and the sentinels in terms of keeping viruses and infections at bay or outbreaks at bay, because every single thing that every single person does is so critical. And that's why we do go through every technical step of why could this outbreak be occurring? Is there anywhere where we've lapsed in biosecurity or compliance? And it's never ever one person's fault. But there have definitely been times where we can pick up a place here and there that there have been lapses, and we just have to go back and fortify those lapses, but never any one single person's fault. Because the truth is, especially with y'all as volunteers, like everyone is working so hard to just get through the day, and we totally know that. But I think what Ramon's outbreak really conveys is there were so many risk factors because of being over capacity. Like straight up, they just weren't vaccinating on intake because they didn't have the time and staffing and capacity to do it. And so those things, you know, we know parvo, distemper, Panluke will come in from the environment. Like, you know, that's going to happen this summer, or it's already happening. And the biggest thing to convey to your staff and volunteers is that you are a frontline defense to preventing that from spreading. It will come in periodically. We know it will, but it's our job and it's our duty and our service, you know, to make sure it doesn't spread. And Ramon mentioned that too, that one of the heartbreaks was that they were realizing that a lot of the parvo cases were shelter required. So we did have some gaps and lapses somewhere in biosecurity, and that's what they were picking up on. Yeah. Ramon, can you talk a little bit about the culture shift, some of the practices? Like, what did that look like? You've shared a lot about open adoptions to me. I would love to hear that. Allison's asking about that.
Yeah, you know, fortunately, the team was so receptive to change, and getting their buy-in was easy. And unfortunately, the outbreak was kind of a catalyst to push that change. And I will say the only thing that was difficult at the start of it was really pushing the team to challenge what they thought the status quo was of what sheltering is and what sheltering looks like. So once it was kind of put out there what we were trying to accomplish, and we were transparent with the process and what we wanted to get from these change, it was essential to also give them a forum to have open feedback and to have input, and to not feel like they can't voice their opinions. So it was being transparent with the process and what we wanted to get to, but it was also being receptive to their feelings and their emotions with the new change. But fortunately, like I said, it was very easy to get their buy-in once they realized that we had animals sitting in crates, and we were euthanizing animals because of the parvovirus. So it was kind of kind of made that transition easy. But that's why it was so critical and essential that post-outbreak that we capitalize on the improvements that we made early on in the outbreak, and continue to build upon the success and the transformation that we were creating. Because our shelter, we had a group of remarkable people, but we really wanted to put effort into defining what we wanted our environment to look like.
Ramon, Chris asked if you can share the outbreak response plan with folks. And then Chris also asked if you can tell them a little bit more about the ASB guidelines book club y'all are doing.
Yeah, so we haven't been able to expand on it as much as we would have hoped to, but it starts out small. When the new guidelines came out in January, we had a few staff members who were really excited with the book. So that's just having conversations about the new some new studies or one thing that we were really focusing on early on was the 5 domains. So it was having conversations about those 5 domains, and it's exciting. I think part of the thing that I like the most is those impromptu conversations where we can kind of create and inspire each other. And the ASV guidelines have kind of been used as that platform to have those conversations with staff. So it's been a lot of fun.
Donna's asking, did ventilation, humidity, and temperature control, did you have any of those problems with the facility? And I know you've mentioned a bit of that, so.
Yes. So we have from the photo that I shared with the dog kennels, we have the high ceiling, and we have about 3 separate HVAC units in the dog kennel area alone. So it's very difficult to kind of manage the airflow. And when this happened during the fall, we had a lot of units that were constantly failing. So fortunately for us, we had a pretty responsive facility and maintenance team that was coming out at sometimes weekly to service and ensure that our units are running properly. But we do struggle and continue to struggle with our HVAC and airflow.
And this is something I learned from one of my facility design mentors, Dr. Wagner, who had come from production medicine, so cow herds, is that there's almost no amount of increased ventilation. Like your HVAC cannot keep up with increased density. If your capacity and your population density increases, like you would need exponential increase in HVAC and ventilation to overcome that capacity increase, which is not possible in facilities. So there is almost no way to overcome ventilation needs and requirements when you go through these, especially a respiratory outbreak. But I know y'all struggled, Ramon, with having like the same HVAC and those different issues.
Right.
And then someone asked, Elise asked, I'd love to get to know a bit more about how you were able to really get the city involved. It seems really difficult to have start those conversations, express needs, and especially now that so many are at capacity.
Yeah, so being the municipal animal shelter for the city, we have that partnership. We currently are under the General Services Department for the city of Norfolk. And for me, being that we had no executive director at the time of the outbreak, I was the point person for communicating a lot of what was happening during the outbreak with our liaison, with our department heads. And honestly, like I said, I turned into a super advocate. I had to be persistent and I had to be honest with my communication, and also was very strategic with the language that I was using with city leadership, because I wanted to stress the importance of what we were going through was a crisis. And I wanted to make sure that I was using words that conveyed the urgency of what we were experiencing. And part of that was being persistent with having the city leadership to come and do a tour and to actually walk through the kennels and see what we were experiencing. And I mentioned that it took some time to get them to do the tour and finally come on site, but it was that persistency and strategically planning and knowing that that was all part of how we were going to really get the action was into getting senior leadership buy-in by coming in, touring the facility. And also it was kind of at the end of the tour, I had handed them the dog assessment kind of guide that outlined areas that we had saw, the areas of concerns, risk factors, and how we could improve. So it was all very strategic and thought out on how I wanted it to look like. But I would say if doing it all over again, I think persistence was the key in communicating with them.
Ramon, Allison, thank you. Allison mentioned that we are at time, and if you and I think we're both happy to continue the conversation at Maddie's Pet Forum.
Sure,
so,
absolutely.
Thanks so much, Ramon, for sharing your story with everyone.
No, thank you.
Yeah, Ramon and Dr. Aziz, both of you, thank you so much for sharing. And Ramon, I can tell you, I've been in this industry a long time, but your calming demeanor, you can tell that you care about your staff. And when you're in crisis like this, when you're able to calmly communicate to your team, and I could tell that getting to the why, to the WHY, why we're going to do something differently. We're in this, we're over capacity. People respond so much better to one, not flipping out, and two, understanding that there's a reasoning behind it. And so that came off very easily from me listening to how you navigated that. And I tip my hat to you. To Chumkee's team, again, they're amazing when reaching out. We're really fortunate in this industry with all the crazy stuff that we're all seeing on any given day, that we're very lucky that we've got groups like this to reach out when we're like, what the heck is going on? And we need some help navigating this. So everyone, we are at our time. Again, I can't thank you all enough for being here. I know we're up to 220 people at one point on the call. We really, really appreciate it. These Monday calls are super important, a good way for us to bring everybody together and try to keep things moving, navigating these really challenging waters that we're in. Ramon, this is terrific to meet you here. I know I speak for a lot of people on this call. We really appreciate you, and hopefully we'll see you on the around the conference circle and be able to put circuit and be able to put face to the name now. And Chumkee, as always, thank you for your great work. Also, everyone, have an amazing rest of your week, and we will catch you next week. Take care.